Another sad milestone we've passed with COVID. We're now past 160,000 COVID deaths in the United States. And there's a widely respected model coming from the University of Washington that says we could see as many as 300,000 fatalities by December. But as many as 66,000 of those projected deaths could in fact be saved if nearly everyone wears masks. And I want to bring Andrew back right now with the very latest on news relating to the outbreak.
And let's begin with even more alarming numbers, Rich. According to researchers at Johns Hopkins, the United States had more than 2,000 COVID deaths in just the past 24 hours. The nation has not seen numbers like that in 3 months. Before we get to our guest, some news today on the schools. We'll begin in New York, where Governor Andrew Cuomo today cleared schools to open up statewide. But districts are still going to have their specific plans approved by state health officials before kids are allowed back into classrooms. Still no word, or still unclear at this point, how New York City schools are going to proceed. Several states, including Georgia, Indiana, Mississippi, and Tennessee, have begun their in-person classes, but there have been many reports of kids and teachers testing positive and quarantines that then followed. On the college level, Johns Hopkins, the latest university to rescind plans to reopen its classrooms. Instead, Hopkins' fall semester will be conducted entirely online. Then there's the race for a vaccine. Now, in the wishful thinking department, President Trump is saying we could have one by Election Day.
I'm optimistic that it'll be probably around that date. I believe we'll have the vaccine before the end of the year, certainly, but around that date, yes, I think so.
What a coincidence on the timing, but as usual, the health experts, they're not as optimistic as the president. Dr. Anthony Fauci warning today that we're probably looking at early next year for a vaccine if we're lucky, and the first round of vaccines are likely to only be about 50% effective, at least at first. Rich, back to you.
Thank you, Andrew. Now, I recently spoke with emergency room doctor Alister Martin. He is on the faculty of the Harvard Medical School and the founder of a group called Vote ER. You know, doctor, it's funny, my wife works at a hospital, and I was struck by some of the docs that said, listen, we love when you bang the pots and pans at 7 o'clock and show your appreciation, but you'd do us even more favors if you wore a mask. And it sounds so simple, but the mixed messaging from governors, let alone the federal government, that took us to this point, is there more than a bit of anger that we're going to be hitting the second wave at some point? We're still not through the first, and we're having debates that the rest of the world has already reconciled, that there's unavoidable realities you have to do for mitigation, but we're still unbelievably in August having some of the same debates.
The only way that we're going to get through this, in lieu of an effective treatment, which there are some things that are promising, but nothing concrete yet, in lieu of an effective vaccine, which again, we have some really incredibly quick development milestones that have been hit, but still, you know, we're not within striking distance of getting that vaccine out. In lieu of those things, we need people at the individual level to take care of the things that they can control, putting the masks on, doing social distancing, and really being stewards of good health for not only themselves, but also their neighbors and their families. And so we need all the help that we can get on the messaging front to make it crystal clear that that's what you've got to do. And there's really no other ways to go about it than doing those kinds of things.
I'm not going to drag into the politics, doctor, but let's talk about what's going with Vote ER, because we all saw the scenes playing out in Wisconsin, and it was surreal that we were having a debate in the throes of a pandemic, forcing people to go wait in lines and to congregate in groups to basically actualize their constitutional rights, putting them at risk. And we now know a lot of people got sick consequently. Talk about, before, the importance of registering to vote, how people should vote in a pandemic. It sounds moronic to have to ask, but absentee and mail-in voting seem beyond obvious as the right way to do it, given the medical realities we're facing.
COVID-19 has made voting a public health issue. There's no two ways about it. You saw what happened in Wisconsin, where we had dozens and dozens and dozens of people who participated in that election get sick. And look, it's not just about the people who are going out to vote. It's also about the poll workers whose average ages are in the 60s. When you look at who gets sick, really sick, and who dies of COVID, it's elderly. It's clear at the end of the day, voting from home is the safest option, full stop. There are patients who I see on a nightly basis in the ER who, I will tell them, look, because of the medications you're on, because of some of the diseases that you have, I don't think it's a good idea for you, a post-transplant patient or a cancer patient on chemotherapy, to sit outside for 4 hours with hundreds of other people potentially touching common surfaces. I don't think that's a good idea for you. If your state has it, you should get a mail-in ballot, and you should get voting from home, and you should do it now, today. We've got to flatten the COVID-19 curve, but we've also got to flatten the absentee ballot curve, so we don't have a ton of people getting their absentee ballots at the end of September and overwhelming the Postal Service. So we've got to take care of that today, and we're proud to have over 100 different hospitals, 50 organizations have come together for Civic Health Month in August to help our patients get absentee ballots so they can vote safely this November.
I wonder the impetus to this. Listen, I interview a lot of doctors, and this, I should mention, Vote ER is a nonpartisan function. This isn't about advocating for a particular candidate or anything. It's just people getting involved in the process and to do it as safely as possible. But how much of this, doctor, is driven because of the recent assault on science and medicine? And to me, I'm not putting words in your mouth, I'm saying that myself, the asinine waste of time that we are doing when we don't have enough of that commodity to fight this pandemic, revisiting things that should just be settled. But how much of it is, as a guy who went to medical school, as a guy who's on the faculty there, that you're having to relitigate things that are fact? How much of that is driving the need for people to actualize their voice in November?
It's both a proximate cause, COVID-19, but also there are more longitudinal causes that I think have really triggered doctors to think about, well, shoot, if we care about creating a more fair, a more just, a more equal healthcare system for our patients, one that does not leave behind the most vulnerable, we have got to get involved in helping create that system. And by the way, the first step to that is helping our patients register to vote. It is secondly, us making sure we get out to vote. A lot of people don't know this, but doctors vote at lower rates than the average population. That can't be. And so, it is not only COVID-19, but it is the repetitive failures of our healthcare system that we've had to struggle with for many, many years that I think is what's sort of triggering doctors to wake up and help get involved in the creation of a better and fair healthcare system.
Well, again, it's Vote ER. We've linked the information, the URL to the bottom of our screen. But not only do I wish you the best with this, doctor, but stay safe. And I appreciate all you're doing.
Thank you so much.
And we'll be right back to wrap things up.